Thank you for joining us for the National Health Service Corps or NHSC New Site Application webinar. I'd like to highlight a couple housekeeping items for you in Zoom. The features available to you can be found at the bottom of your screen. While the chat is disabled, if you have any questions, please type them into the Q&A pod located at the bottom of the screen. If the questions that you've entered are not answered, please attend the Q&A session on May 21st from 1:30 to 3:30, or I'm sorry, from 1 to 3 Eastern, where we'll have multiple DRO staff available to answer all of these questions. Thank you again for joining us today. We hope that you find the webinar incredibly helpful. Now I'd like to turn things over to Captain Tracy Galani. Tracy.
Thank you, Carl. Hello and welcome to today's webinar. My name is Captain Tracy Galandi and I'll be your moderator today. The focus of today's presentation will be to provide you with an overview of the NHSC site application requirements. We may have some time at the end for a limited number of questions utilizing our Q&A pod if we finish before the top of the hour. Please enter those questions into the Q&A pod following the presentation. As Carl said, any questions not answered today will be answered next week during our Q&A session, so please attend. Today, we will have two presenters from the Bureau of Health Workforce's Division of Regional Operations. Please welcome Lieutenant Christina Lee and Lieutenant Commander Lee Ryder. At this time, I will turn the presentation over to our first presenter, Christina Lee. Also, I will let you know this session is being recorded and will be uploaded as a resource on our website. Thank you.
Hi, everyone. Next slide, please. So thank you for the introduction, Captain Galandi. I also want to thank you all for taking your time to join us today in this training. As you can see, this is our agenda. It's pretty simple, similar to last year if you attended. And now we'll begin. Next slide, please. So now let's talk about the benefits of joining the NHSC program. As an NHSC site, your site would be eligible to receive NHSC scholars and participants that have agreed to a loan repayment program, and this will hopefully expand your pool of potential employees to hire as a recruitment benefit. Next slide, please. To apply, your site must meet eligibility requirements, which include providing outpatient comprehensive primary care services, be in a health professional shortage area or HPSA, and remain compliant with the NHSC Site Reference Guide and Site Agreement. Next slide, please. As you can see, this is a list of eligible non-auto-approved sites. These sites must apply during the open cycle and recertify every 3 years. There are some nuances to the application for some of the site types, such as the critical access hospitals and rural emergency hospitals, which must be affiliated with an outpatient clinic, both of which must be NHSC approved to be eligible for the program, but we will go into more detail later in the presentation. Next slide, please. This is a list of eligible auto-approved sites. These sites can apply once they are operational. They may apply at any point of the year and do not require to recertify as the non-auto-approved sites. Like CAUSE or critical access hospitals and REHs or rural emergency hospitals, IHS and tribally operated 638 hospitals must be affiliated with an approved outpatient clinic. Next slide, please. This is a list of ineligible sites to the program, so please take note. Clinics only serving a specific population, such as to veterans or active duty personnel, residential facilities, facilities that only provide 100% telehealth services, and only provide general SUD services, meaning that these SUD services, or excuse me, these general SUD sites only provide that and no other services such as primary care or MOUD, for example. Specialty clinics such as cardiology or sports medicine, for example, are also ineligible with the exception of OBGYN, pediatric, and geriatric sites. Next slide, please. As you may already know, the cycle is now open from May 6th to June 17th. Please do not wait till the last minute, taking into consideration any IT issues that may occur. Next slide, please. So starting with your application. Next slide. We highly recommend for you to review the updated NHSC Site Reference Guide and Site Agreement. As the main site POC, please ensure you have the role of administrator to complete the site application. Only upload the required documents and save as you go through each section, or it will be lost. Next slide, please. To make an account, you must also set up a multi-factor authentication with Google, which requires a phone or tablet to access the portal. This was added for additional security this year. Next slide, please. This slide indicates the step-by-step of how to set up your multi-factor authentication. Next slide, please. This lists out the steps on how to submit a site application within BHW or the portal. If this was a site that had previously applied, it'll be listed under My Sites. You'll click on the name of the site in your dashboard as a site POC and start an NHSC site app. If your site has never applied before, then you'll have to click on the Create a New Site link. Then you'll click on a Start an NHSC site app in the profile. Please follow the instructions and review and sign the NHSC site agreement towards the end. Once you submit the application, it'll undergo review for approval. Next slide, please. So this slide lists out the sections of the application, which we will go into further details step by step. Next slide. Please take note of the site types that are exempt from certain application sections. These site types are typically the auto-approved, and the exemption sections include the behavioral health section, payments and insurance, and the upload documents section. Free clinics are also exempt from the payments and insurance section. Next slide, please. Check the eligibility of your site by listing out the descriptions of your site. There will be drop-down options for you to choose from. Please be mindful of what you choose as your site type. Specifically, FQHCs or fairly qualified health centers and lookalikes are certified by the Bureau of Primary Healthcare within HRSA. OTPs or opioid treatment programs are certified by SAMHSA, which are location specific, and rural health clinics are certified by CMS. If you are applying as a rural emergency hospital, please use the Critical Access Hospital or CA as your site type. Next slide, please. In the Confirm Site Details section, you'll enter general information for your site as you can see listed. Again, some of the specific site types have specific IDs, such as the CCN number for CMS certified rural health clinics. Please enter these unique IDs if you do have them. Next slide, please. In the Services and Staffing section, you'll select the services that apply to your site as well as the staffing that is currently employed, as well as if they are full-time equivalent or half. Next slide, please. In the Check for Existing Sites section, please ensure that this new application is not a duplicate. If there is an existing site record, stop and access this existing site record with the help from your regional analyst. Next slide, please. In the Behavioral Health section, your site must have a mental health HPSA score. Core services listed must be provided on-site, and non-core services can be provided either on-site, in-network, or off-site. Next slide, please. So this slide details the type of documents that are acceptable proof of these services. In the behavioral health section, there is a part 4, which allows you to list the affiliations to that site that provide these off-site services. This is acceptable proof of those services as well. Next slide, please. In the payments and insurance section, you will need to upload the bulk of your required documents, which we will explain in a few moments. The site must accept Medicare, Medicaid, and CHIP or CMS programs. Please enter the facility IDs to these programs. If you do not accept certain programs, such as CHIP, for example, then you must provide an explanation in the text box. There are limited exceptions to this. This section also has you input a nominal fee for patients at and below 100% federal poverty guidelines. If there is no charge, then enter 0. Please do not leave anything blank in this section. Next slide, please. Moving on, you must input 6 months worth of data, preferably the most recent from your site. I recommend you refer to the NHSC site data table guidance for detailed instructions on these data points. This is available to you in the NHSC website under resources. Please keep in mind that the site data table information is location specific and not network data. Next slide, please. To emphasize, the sliding fee discount program is to minimize financial barriers to care for patients at and below 200% of the federal poverty guidelines and ensures eligible patients have access to all primary care services regardless of their ability to pay. Next slide, please. The program eligibility is based solely on family size and income and no other factors. Your program must be for both uninsured and underinsured patients with annual incomes at or below 200%. Although now we are allowing screening for alternate payment sources, it cannot create a barrier to be eligible for the sliding fee discount program. For example, your site cannot require applications to CMS programs and or proof of a denial letter from these programs to be eligible for the sliding fee discount program. Next slide, please. Documents that must be uploaded in this section include the sliding fee discount program policy, patient application, sliding fee schedule, signage photos, and a website screenshot with the same required verbiage of the signage. Free clinics follow a different requirement that must provide documentation stating that, quote, no one will be charged or billed for services and individuals are not denied services because of inability to pay. Free clinics may bill third-party payers, but this must be at no cost to the patient. Next slide, please. The sliding fee discount program policy needs to include patient eligibility, frequency of patient eligibility reevaluation, definitions of income and family size, documentation and verification requirements to determine eligibility, how your site advertises the program, explanation of nominal charges, if any, and collection policies, if any. Be mindful the policy must have these items at a minimum. Next slide, please. The sliding fee discount program application for patients should be limited to questions about family size and income, but may screen questions for alternate payment sources. However, again, these cannot determine eligibility for the sliding fee discount program. Please take note that the application cannot require these items listed on the slide, and more specifically, a denial letter from CMS programs. Next slide, please. As you can see on the slide, this is an example of the sliding fee schedule for 2025, which is what we expect to be uploaded. Next slide, please. The sliding fee schedule must reflect the most up-to-date federal poverty guidelines, which provides a full discount. Your site may or may not have a nominal fee, which is fine, for those at and below 100% federal poverty guidelines. Again, a sample of these required documents is in the NHSC website under resources. Please use these to your advantage. Next slide, please. Your site must upload the sliding fee discount program signage, which must include the verbiage, "No one will be denied access to services due to inability to pay, and there is a discounted sliding fee schedule available based on family size and income." This must be verbatim on your signage. One photo is a close-up of that signage, and a distant photo just shows where that signage is posted, like the lobby, for example. We also expect a screenshot of your website, which will also include that same verbiage. This is an example of what we are looking for on the right. Please do not upload a Word document or PDF of the signage. We need photos of where it is located. Again, one close up and one distant. Additionally, until you are NHSC approved or active, the NHSC poster and our logo cannot be used. Next slide, please. And now I'll hand it off to my colleague, Lieutenant Commander Lee Ryder.
Thank you, Lieutenant Lee. So moving right along, this slide indicates 3 separate sections: the telehealth, the identify points of contact, and the review health professional shortage areas sections. In the telehealth section, please be mindful that sites providing 100% telehealth services are not eligible for NHSC. In the Identify Points of Contact section, we require 2 active POCs that cover all 3 roles listed: administrator, personnel verifier, and recruiter. You may only submit an NHSC site application if you are listed as the administrator role. In the Review HPSA section, you must have a HPSA score for the type of services listed. There are some variances, including CMS certified rural health centers, which will receive a facility HPSA after the NHSC site application is approved. State prisons cannot use geographic or population HPSA scores and must receive a facility HPSA before submitting an application. The Upload Documents section is where you should add your site's recruitment and retention plan, proof of access to ancillary inpatient and specialty care, substance use disorder documentation, and medications for opioid use disorder attestation letter if applicable. If your site is a mobile unit, you will also upload a list of your mobile unit stops in this section. We'll go into more detail on each of these documents next. Proof of access to ancillary, inpatient, and specialty care. As a site, you must function as a part of a system of care that offers or ensures access to these essential services. For example, ancillary care refers to laboratory or radiology services, and specialty care includes referrals to specialists such as endocrinology. Listed on the slide are the documents we accept as proof of these services. The Recruitment and Retention Plan. This should include how you maintain clinical staffing levels and support clinician well-being to serve your community appropriately. You may reference a sample we provide on the NHSC website under Resources. Substance use disorder documentation. If you list that your site provides substance use disorder counseling services, you will have to provide proof of these services by uploading one of these documents. Keep in mind that if you are a site that only provides SUD services and no other services, this site is no longer eligible for the NHSC program. Sites providing medications for opioid use disorder, or MOUD, must upload an MOUD attestation letter. This is a letter with the listed components on the slide that must be signed by the CEO or medical director. Again, a sample or template is provided under Resources on the NHSC website. If your site is a SAMHSA certified opioid treatment program, or OTP, this means you will be listed on the SAMHSA OTP directory as seen on this slide. This is specific to the location and not by organization. If the site is not listed in the SAMHSA database, the site will need to provide the SAMHSA certificate to show they are a certified and accredited OTP. Before submitting the application, please review all of the sections and ensure you have uploaded all of the required documents. Read the NHSC site agreement before certifying and signing it. If there are any missing documents or application sections, you will not be able to submit your application. We'll now review a couple special considerations. Sites affiliated with outpatient clinics include critical access hospitals, rural emergency hospitals, IHS hospitals, and tribally operated 638 hospitals. These sites must be affiliated with an outpatient clinic that is also approved for NHSC. Both the hospital and outpatient clinic must utilize a sliding fee discount program as previously discussed. NHSC participants that are employed at these sites must provide weekly patient care at the affiliated outpatient clinics. Both the hospital and outpatient clinic sites may apply for NHSC, but you must submit the application for the outpatient site first, as you will have to list the outpatient clinic on the hospital application. Please also note that rural emergency hospital sites must select critical access hospitals as the site subtype until our site updates with the appropriate site type for REH. We will now have a couple questions to test your knowledge. You can answer on your own time along with us. So the first question, which documents are required components of the NHSC site application? A, sliding fee discount program policy. B, proof of access to ancillary specialty and inpatient care. C, sliding fee discount program patient application. D, recruitment and retention plan. Or E, all of the above. The correct answer is E, all of the above. All of these documents are required components of the NHSC site application. Our next question. Can my site's sliding fee discount program require patients to apply for Medicaid or require patients to obtain proof of insurance denial before allowing them to apply for and be eligible for the sliding fee discount program? Yes, no, or I don't know. And the correct answer is no. The site cannot require patients to apply for Medicaid or require them to obtain proof of insurance denial in order to be eligible for the sliding fee discount program. Once approved for NHSC, you must maintain your NHSC active status. As a site point of contact, please ensure that you maintain an active status in the portal by logging on regularly and updating your site's information. If you do not log in after some time, your status will be changed to idle and you may be locked out. It is recommended to keep all of your NHSC required documents in a folder and update based on the annual NHSC site reference guide requirements. You will have to recertify every 3 years if you are applying as a non-auto approved site. And I will now turn the presentation back over to Captain Galandi.
Thank you, Lieutenant Commander Lee Ryder. Thank you for attending today's webinar. If you have questions, please enter them into the Q&A pod at the bottom of your screen. If your question is not answered today, please attend our Q&A session on May the 21st from 1:30 to 3 o'clock Eastern Time, where we will have multiple DRO staff available to answer questions. The link to this webinar, the NHSC site reference guide, and all of our sample policy documents are available on our website, along with this recording after today. Thank you, and I will close the presentation, but I will leave it open for questions in the Q&A pod.